Hi guys, today I have Dr. Divya Kishore who has secured an All India rank of 8 in her NEET PG 2025 and who has also got 7 gold medals in her UG time. Congratulations, Dr. Divya.
Thank you, Dr. Vaibhav, for the lovely introduction. It is great to be here today. And congratulations to you too for a wonderful rank in NEET PG.
Thank you. So guys, in this interview or conversation, we are going to discuss about things which a UG student and interns and also the PG aspirants should focus on. Like Divya will guide us about that. So before going to that part, so we'll ask some questions to Divya, like how was your UG life?
I think 6 years of UG was wonderful to say the least. Like starting from the foundation course till the last postings of internship, it was like one crazy ride. And not just academics, even the co-curricular, extracurricular activities, then the fest, the medical conference, and so many sleepless nights in internship, so many first things that we did in internship. So I think a lot of memories to cherish.
So as you told about your UG life, so coming to the academic part of your UG life, Divya, is it important to study from standard medical textbooks? What's your take on that?
I think yes, standard textbooks are like very crucial and they're big. Yes, you have to do your standard textbooks. There's no other option. There's no alternative for a standard textbook. So especially the first and the second year textbooks, because like they help build your basic concepts and they actually enhance your application skills. And as you go on to read these textbooks, you will understand that they also integrate with the other textbooks to give you a holistic understanding of the entire subjects of MBBS. So yes, standard textbooks are very important, and more so important are the first and second year subjects because like irrespective of what PG you're taking, so these are the basic sciences that every doctor needs, and so it is a must to read them.
So can you name a few which you have read in your UG days?
So I think the best book I've read is Robbins, no doubt. So especially the volume 1 of Robbins is like a great book to actually understand what you're doing because in first year it looks too theoretical because we are not exposed to a lot of clinical postings or have never seen a patient. We just are in the dissection halls. So entering into second year, when you start reading Robbins, that's when you start connecting things. That's when you start relating to patients that you see in your clinical posting. So I think that is one wonderful book. And first year physiology, Guyton, Genong is also a good book. Like probably you can't read it entirely, but you can like refer it. And anatomy, I think the Indian authors should be sufficient because it is voluminous by itself. So I wouldn't exactly recommend reading Gray's Anatomy and all because it is too vast. So for anatomy, Indian authors should be enough. And biochemistry also, textbooks like Vasudevan are like good enough. Definitely not the textbooks like R.M. Prasad, but Vasudevan is a very good textbook. The thing is with the short textbooks, I'm not saying that they are not at all useful, but you have to know when to read those books. Like starting off with the shorter textbooks is a big no. So you can read your standard textbooks once, twice, and later in the last 1 or 2 weeks prior to your university exams, if you're overwhelmed by the volume of the larger textbook, then you can read the shorter textbook. But you should not go in with the mindset that, yeah, I have a shorter textbook to depend on, so it's fine even if I skip the standard textbook. So that should not be your mindset.
And what do you think that one mistake our juniors are making? I mean, during their UG days.
I think one thing that I recently actually realized is I spoke to a few juniors who have just cleared NEET UG and they're entering MBBS and they wanted to talk to me. And I was like, yeah, okay, probably they want to know about MBBS and stuff. But the first question they asked me is how to prepare for NEET PG. So I was really taken aback by their question. So MBBS is actually a very holistic journey to become a doctor. So you should not just reduce the entire MBBS to an entrance exam. So in fact, NEET PG is just a bridge connecting your UG and your specialization. So starting off MBBS with the only aim of clearing NEET PG is something that should not be there. I don't blame them entirely. Like the society is also at fault because the moment you join MBBS, all your relatives are asking what do you want to specialize in. So, but yes, as seniors, we have to guide them that you have to go through and like live every part of the MBBS journey fully and not just stick to your coaching platforms or your notes and be behind MCQs from the very first day. So that is not how you should go about it. And one other mistake is like I've seen juniors read Harrison during their clinical, like missing their clinical posting. So they utilize that time to read books sitting in the library. So I think that is not a thing to be done. Yes, reading Harrison is an amazing thing. I think we seniors also should get inspired to read Harrison looking at them, but not at the cost of your clinical postings, because clinical postings give you something beyond the textbooks. So the subtle learning, like your bedside manners, how you examine the patient, and yeah, ATCOM was introduced for us in RS4. They made us sit in classes and do ATCOM, but ATCOM is something that you have to learn in your wards, your attitude, your ethics, communication. And only when you actually interact with patients that you'll actually realize the complexity of medicine. Say, for instance, a hepatomegaly, like how to examine, you can just read it from your clinical textbooks. But when you actually go to a patient, that is when you realize that how difficult it is to do it in an obese patient, in an ascites patient, probably in a pregnant woman, how it actually feels. So many subtle things that is to be learned only from your clinical postings by actually doing it. Yes, many complain that no one teaches us. There's no one to discuss cases in the wards. So it happens. I'm not saying that it doesn't happen, but like we have to be very persistent and active on our part to like take cases whenever they are busy, and whenever they are free, we have to have the cases ready so that they will be able to discuss it at length. And you have to be behind your PGs, SRs, or like join classes of other units which are going on. So basically, you have to be on your toes and you have to somehow make it happen. But don't sit in the library and study Harrison during that time, is what I would say.
Yeah, like most of our juniors do that only. If no one is taking class in wards, they come back to reading room and start studying. I guess they will not understand the practical part of this medicine unless they do it in wards. And another thing, nowadays juniors are taking coaching platforms from the first year itself. So, what would you like to tell about that?
I think, yes, over reliance on the coaching platforms is becoming the trend nowadays. So it is okay if you have the coaching platforms, because in some ways they will be helpful. Say anatomy is a very visual subject. So if you like watch a video of something, you could understand the relations better. But again, you should either start with your standard textbook or like come back to your standard textbook after watching those videos. So you like use it to like fill in the gaps which you are finding difficult to understand just by the standard textbook. But coaching platforms are like never a replacement for your standard textbooks.
So it should be a supplement instead of a substitute for your like studies. And what resources you used for your preparation, Divya?
So I actually used DAMs for watching the videos of most of the subjects, and for question banks, grant tests, and yeah, the pearls. I have used Marrow. So
So, Sunday.
I did not use like stuff like DVT or BTR, because I'm a person who feels that whatever I've already done, if I do it again, I will be more confident with it rather than like starting off a new source, even though it is a shorter version of it. So, but yeah, so you could use those sources as well, but only once you have finished your standard books, your in-depth reading of your all 19 subjects.
So I guess if you have better conceptual understanding, you don't need that like those kind of DBT, BTR.
Yes, definitely. So ultimately, it depends on what kind of a person you are. So if you're someone who's overwhelmed by the amount of stuff, because 19 subjects is a lot to like revise in the last 1 month. So in such a case, when you've read the 19 subjects and you need like one source which you can like just skim through at the last month, so at that moment you can still use them. But again, I would recommend that you stick to what you originally used because it'll stay with you longer.
So what was your last month's strategy then?
So the last 1 month, I revised, probably, so like our exam got postponed, right? So after the postponement, I did one revision of the subjects. Like I, in fact, used a hybrid approach. Like every subject, it was not like I did the notes, Q bank, and the custom modules. So hybrid approach in the sense, for some subjects, I did just the notes. For some subjects, I did just the Q bank. Like physiology, I was very comfortable with it. So I did not go to read my notes again. So I did only the Q bank. So this was the hybrid approach I followed, but I had one approach for every each of the 19 subjects. So that I did one revision in 1 month. prior to the exam, and in the just preceding month of the exam, again in the first 15 days, I tried to do whatever I did in the previous month again. That is revision of all the 19 subjects, whatever I decided, be it Q bank or notes for that particular subject. And the last 15 days, I entirely dedicated it to revising the previous year questions again.
So one thing you told in your previous interview was you never, I mean, you did revision of some of the subjects by only solving questions. I guess that is one of the
Yeah.
better strategy to adapt, because in your internship you don't have the time to open notes and study, and it will not like uh, be that helpful. Otherwise, if you use like question banks for that purpose, I guess your mind will be actively involved in that thinking process, correlating multiple subjects or multiple topics. So with that, you can improve more, like beat your score or anything. Okay, Divya, did you study from USMLE first aid?
No, I didn't.
Uh, Divya, I have seen you participate in a lot of quizzes and like many other competitions. So what's your take on that? Will that help you for your preparation or building your concepts?
So I think quizzes is something that I really love. So I didn't have the mindset that, oh, it might help me in NEET PG. And so that was not why I really participated in the quizzes. But like, yeah, participating in quizzes and even more like organizing the quizzes, I think is a greater challenge than actually participating. So it actually like builds your critical thinking, your application skills. And in quizzes, like you don't just get fact-based questions. So it is a lot of integration between years because there'll be preclinical, paraclinical quiz. So they integrate with a little of medicine, little of surgery. So that integration helps you like again hone your concepts, and it is something that really spikes my interest. And so I like the adrenaline of the finals and to think on my feet. So like yeah, so in that way, quizzes have really helped to develop that critical thinking, like right before the time I started solving MCQs for the entrance exam. So yeah.
So one more thing I would like to recommend is if there is any quiz competition in your college, especially of those short subjects like psychiatry, DERMAT. So try to participate in that. So by participating, you will be preparing for that particular subjects, and you don't have to read them again like in internship, and it will be helpful for you while revising, I guess. So Divya, one more common confusion among our third year students is, however, they will get a like good amount of free time in their third year. So whether they have to study final year subjects or they should study first year and second year subjects. So what's your opinion on that?
So first, as a third year student, you have to study third year subjects. Like, don't forget that because like I know it's like not that important from the UG perspective, you would say like ENT and Ophthal, but that is all the more reason you have to study during that time because you'll never study it again. So like first finish your third year subjects. And yeah, I think from because of the new curriculum change, they just have to give FMT and PSM exams in the third year, and the remaining all the clinical subjects they give it in the final year. So like, yeah, I would still suggest like do your FMT, PSM of talent ENT, and along with that, you'll be having clinical postings of many final year subjects. So you have to read your clinical textbooks of those final year subjects. So because unless you read those clinical subjects, you can't examine patients in the ward and you can't correlate what's happening in your postings. So these two definitely you have to do a little extension. So whatever clinical postings the topics are happening, say you'll be examining a CLD patient in the medicine wards, so you could come back and read the theory of CLD. So a little extension from your clinical books. So over and above that, if you still have time, so I would recommend reading a little bit of medicine, OBG and surgery. And along with that, you can do a little correlated pharmac, micro and path. Because like these second year subjects and fourth year subjects have a lot in common. So in fact, these second year subjects make up 80% of medicine. Like being in third year, you can do a little of both so that you'll have a better understanding of those subjects.
Okay. And as you got all India rank of 8 during your internship attempt only, so does the internship help in our preparation or it is an like obstacle for our preparation? So what's your opinion on that?
So yes, like if you look at it with a bird's eye view, definitely internship is all about long duties, long days, very little time to study. So like we might actually have an opinion. So even in fact, even I had an opinion that so probably if I gave NEET after fourth year, probably will remember more stuff than spending a year in internship and then forgetting stuff and giving. So but actually like going through internship, what I realized was you could learn a lot like from your departments where you're posted. Because like what we say PYQs, so they're nothing but the common diseases, the common conditions we see around in our patients. Yes, we look at it as PYQs because they're being repeatedly asked every year, but why they're being asked is because they're the common conditions. So like if you are vigilant in your internship, like just not don't just go about it in a mechanical way. So instead you have to like
Like take it
you're
positively, like
okay.
go to wards and see the cases.
Yeah. So like say you're in medicine posting. So instead of just like putting a pulse ox, measuring the BP, scribbling that in the file, and then moving ahead. So just take 1 minute extra to see what case it is. So talk to the patient. So if you do that, so you'll know what case it is, and so you could also pay attention in the rounds. So and you will get interested, and your PGs will be discussing. So you will overhear them, and so you will get a lot of things from your internship, and also be free to discuss all these cases with your PGs, with your seniors, and so that will actually help you uh, to stay in touch with the subject. So even though you're not able to go back after internship and put in like 1 or 2 hours, the small things that you do will actually matter a lot. And one other thing is internship, you can't go in with the mindset that I have to study for 2 hours a day. So in fact, you should not have that mindset is what I would say, because you won't be able to do that. And if you are not able to do that, finally you'll lose hope and like quit studying altogether. So instead, if you have a dynamic approach, so your approach should be to study in the time you get. So if you get 10 minutes, 15 minutes on some day, it is fine. So that much is more than enough. So that will actually help you capitalize the time uh, on a free day.
I guess one more thing about this internship duties is if you are studying little bit and applying it while discussing with your seniors or PGs, you will get to know about recent changes in the guidelines, some rare drugs which are used for the treatment, which you never heard, or you might never like you might have seen in your textbooks, but you have never seen those drugs. But they'll be using in our words, like for example, romiplastim, something is there they'll use for TTP and all. That questions, like those kind of questions, will be asked directly in the NICT, which we feel like, oh, it is difficult, but we are like we have that resource. We should go to wards and see the cases, I would suggest. Okay.
Yeah, and one other thing is like it is like only the only year in your life where you'll go through all the 19 departments. So whatever you've seen in the last preceding 4 years of MBBS, no, so this 1 year is actually a practical application of all of that. So you'll never find it in the past nor in the future. And so these are the ones that are actually tested in NEET PG as well. So even in the recent NEET PG, there was this question on episiotomies. What is the layers, order of closure of the layers in an episiotomy wound? So the only thing that flashed into my mind that time while answering that question is my PG teaching me how to close the layers, like start from the apex, a little above the apex, and then go and order the mucosa. So that is what I remember rather than what I had read in a textbook.
And with these duties, how you manage to solve MCQs and grand tests during your internship?
So that's what I did not read a lot of notes during internship. So my major source were the Q banks only. So that also I did not have an exact number, as I said. So it was all very flexible. So some days I would solve just 5 or 10 questions. Some days probably it would be 50 questions. So I was very flexible, and I was mostly doing questions of the subject, the same subject as the department I was in, so that some refreshing of the knowledge also happens, and so it'll help me apply the same thing in the postings as well. And GTs I would give like once a month starting last April, like since April 2024 I was giving it once a month. And so GT would usually be on a Sunday or a day I've taken a CL, so I would not venture into giving a GT after my day long posting search.
So what was your
That's
first
it.
GT score and the GT score before NEET PG?
I think the first score was 120, if I'm not wrong, 118 to 120. So the last GT score was somewhere 165, 170. Probably.
Okay. And what's that one turning point you would consider in your preparation journey, like that helped you get this rank?
I think the postponement was a great, great blessing for our entire batch, like the entire 2019 batch. Because like even before the postponement, I was like, I will definitely give it my best attempt. But I didn't have much time in my favor to like do all the stuff that I wanted to do, because we had hardly a month and a half after internship. So that time I had done only the PYQs mostly, but after the postponement, I like reorganized my study plan for the next 2 months. And that is the reason I was able to do a little bit of my notes, so revise them and then revise the PYQs again. So I think, yes, the
And
postpone.
coming to your exam day, how was it, and what was your mindset on that day? And what do you think most people like? What mistake they do on that exam day?
So actually, my exam was again in Davangere, so I had to travel. So I was there the previous day only. So the previous day was I actually had kept very little stuff to study for the last few days. And after I realized it was in Davangere, I further reduced it and then kept like very minimal stuff from my 20th notebook because I told myself that you should not stress yourself and you have to stay calm. So I think that is very important to stay calm because you have to go into the exam with the best mindset. And you will also get that 1 hour before the exam where you have to go to the exam center, but your exam is yet to start. And so you will basically be free for that 1 hour. So I think how calm you remain in that 1 hour. So take some deep breaths and just don't focus on the result. Just tell yourself that you have to do your best today. And even if it's a false belief, it's fine. Tell yourself that today is going to be your best day and go ahead with a positive mindset. And I think, yes, giving GTs beforehand actually prepares you to sit for those 3.5 hours. And it prepares your brain to avoid the brain fog and the fade and loss of attention in the last phase of the exam. Like last 1 hour or so is like very difficult part. So you have to prepare yourself beforehand through GTs and practice.
And see, nowadays people are like so fond of taking fast seating first attempt. Like they are very eager and they are leaving their duties. They are taking extension and coming to reading room for that. So, what's your advice for those people, those who desperately want to take in first attempt? So, what would you suggest for them?
I think more than thinking so much about the outcome, I think you have to be focused more on your preparation and journey because like outcome is something that you really can't control. Like one bad mood, one bad phase in the exam also could like literally reverse your result. So yes, like, but what I would suggest is like every like your immediate attempt has to be your best attempt. So whether you've been studying for 1 year or whether you've been studying for the last 1 month or haven't studied at all, so yes, you still have some basic knowledge. So you have to give the best in your first attempt because you don't know what your future exam will be. And also in the first attempt, you are actually less stressed than your subsequent attempt. So that is a big advantage on your side, and you'll also not second guess yourself too much. Say a simple question comes in the exam, a person who has studied for 1 year will have a lot of differentials, lot of thinking going on in their mind, but like someone who's attempting it like freshly for the first time, so you'll go with the most common answer which will most often turn out to be right. So you have a lot of things on your side, so I would say give an honest attempt. Your first attempt should be an honest attempt. So if it doesn't turn out fine, absolutely no problem because like you have adequate time where you can plan yourself. And if you have given an honest attempt previously, you'll actually know where you stand than just giving it for the sake of giving an exam where you don't give it wholeheartedly, you won't know where you stand.
Okay, Divya, what was your best experience during your internship?
So a lot of good things, like a lot of firsts in internship were all very good. But like one thing that actually stands out when I look back today is like one patient that one not patient, one woman whom we delivered in the labor room, and then I was in the last few days of my OBG posting, and then she was shifted to the postnatal ward along with her baby, and then I also moved to pediatrics, and then I was in charge of that postnatal ward, and so I was weighing the baby, checking the baby every day, and so I could see the amount of trust the parents had in me because they had seen me right from the labor room. So this continuity of care from OBG to pediatrics, like dealing with both the mother and child holistically, is something I think you will never get in the future. But I got to like experience that in internship, and it gave me a lot of happiness. And the funny thing is, the baby's grandmother also came. She suffered a stroke and came to medicine 2 months later when I was actually in medicine. And so the baby's father was like, "Oh, you work here also," and it's like, yeah. So that was a good experience.
I guess the amount of gratitude they show when they trust you is really like.
Yeah.
And which postings you liked the most in internship?
I think OBG labor room.
Okay. And so we are now like we are done with your academics NEET PG preparation strategy. So what are your hobbies, Divya? Like what do you do in your free time?
So I like reading novels, mostly fiction. Then I do a lot of puzzles, Sudoku, crossword, scramble. Then I also love cricket. So I follow cricket, watch, and if there's an opportunity, I play. And apart from that, playing carom, occasionally badminton. Then I like music. Um, then yeah. So, but most of the free time goes off in like what little free time we get during, like, say, internship goes off in sleeping and watching movies and some OTT shows.
So you participated in cricket during our Rise and Trons Premier League.
Yeah, I did.
Okay. Divya, before we conclude, we'll have a rapid fire session. So standard medical textbooks or coaching platforms?
Standard textbooks.
Seniors guidance versus self study.
I think hear out your seniors, like learn from their experiences, but ultimately design your own approach.
Yes. Multiple platforms versus single platform.
One platform for one subject.
Basically, multiple platforms.
That is up to you depending on the access to seniors or others.
So choose a good teacher, like from whichever platform they are. So what's harder, biochemistry or pharmacology?
Biochem.
Fixed schedule during your preparation or dynamic schedule,
Dynamic during internship, post internship fixed.
which is more difficult, a grant test or an EPG?
NEET PG because of the impact rather than the question.
Like what's harder, like whether to start preparing or staying consistent during our preparation?
Staying consistent.
One last and very important, tea versus coffee.
Coffee.
Okay, Divya. It was fun taking your interview, and congratulations once again. Like which branch you are interested in, Divya?
I am interested in taking MD General Medicine.
Thank you so much, Divya, for taking up this interview. Hope this helps those who are preparing during their internship or those who are in their UG days. Thank you, Divya.
Yeah, thank you so much. It was a fun session.